One of the most recent and well-publicized tragedies in American medicine is the opioid crisis. It's worth reminding ourselves about what happened. The opioid scandal in the United States is a tragic crisis, a catastrophe that has its roots in various factors, including the actions of doctors, pharmaceutical companies, and societal influences. The opioid epidemic began to gain momentum in the late 1990s, largely fueled by the aggressive marketing and promotion of prescription opioids by pharmaceutical companies. At the same time, forces within medicine were promoting pain as the fifth vital sign, with zero pushback from the medical profession. Pharmaceutical companies assured doctors that opioids like OxyContin, a potent painkiller, were effective for managing pain and had a low risk of addiction. This misinformation led many healthcare providers to prescribe opioids more liberally, believing they were providing their patients with a safe and effective solution to pain management. Doctors played a significant role in the opioid crisis by overprescribing these medications, especially to patients whose pain levels didn't warrant such strong prescriptions. Many physicians received inadequate training on pain management and were misled by the pharmaceutical industry's marketing tactics. They also didn't use their own common sense or perform their own research. Doesn't that sound familiar? Consequently, millions of patients were prescribed opioids for various conditions, ranging from mild, acute, and chronic pain to post-surgical recovery. This widespread use of opioids contributed to a surge in addiction and overdose cases. The consequences of the opioid crisis have been devastating. Over the past couple of decades, hundreds of thousands of people in the United States have lost their lives to opioid overdoses. Yes, you heard right, hundreds of thousands of deaths. According to the Centers for Disease Control and Prevention, the CDC, over 500,000 people died from opioid overdoses between 1999 and 2019. Considering the CDC's tendency to be incompetent and to themselves spread misinformation, this number is likely an undercount. The crisis has torn apart families and communities, leaving a trail of destruction and heartbreak in its wake. Efforts to address the opioid crisis have finally included stricter regulations on opioid prescribing, improved physician education on pain management, and expanded access to addiction treatment services. Additionally, pharmaceutical companies have finally faced legal action for their role in misleading doctors and the public about the risks associated with opioids. In conclusion, the opioid scandal in the United States began with the aggressive marketing and promotion of prescription opioids by pharmaceutical companies. Doctors played the main role in overprescribing these medications. The result has been a devastating loss of life, with hundreds of thousands of Americans succumbing to opioid overdoses. Are doctors to blame, and did they go into the profession wanting to do such harm? No. Every doctor can't be held responsible for the opioid crisis, but collectively, the medical profession must admit to being complicit in hundreds of thousands of deaths. The opioid scandal wasn't the first medical scandal, and we know it's definitely not going to be the last.